there, my name is Catherine Valley. I'm a PTA student here at Penn State Hazelton. Can I verify your name and date of birth?
Alyssa Marlowe, 12/16/2004.
And do you know where we are today?
At Penn State Hazelton.
And do you know what month of the year it is?
It is April.
Good. And do I have consent to treat you today?
Yes.
Okay, perfect. So from what I understand is you're here because you have a diagnosis of ALS and you are starting to have some kind of challenges due to that progression of that disease. It says that you're having some frequent falls, you're having lots of fatigue, decreased balance, range of motion, strength, all those sorts of things. Is that correct?
Yeah.
All right. So what we're going to be doing today is we're going to be focusing on working on your balance and your endurance. So we're going to be doing a little obstacle course. I have it set up in the hallway right outside this door.
Okay.
We're going to be doing that to work on that. And then we're also going to be doing PNF, which is proprioceptive neuromuscular facilitation, to work on some ADLs because you're having some difficulty with that sort of thing, just to get more functional with that strength and endurance. But before we get into that, just kind of some things to expect with this, since we are challenging kind of those areas you're having difficulty with. You may have some fatigue, some frustration. That's totally normal, and we're going to work through it. So if at any point you feel too tired, let me know. We will definitely include a break. And then I'm also going to be putting the ski belt on you for your safety and mine throughout this, so I can make sure to guard you accordingly. Okay, and then before we get started, there are a couple things I need to ask you. So on a scale of 0 to 10, 0 being no pain, 10 being the worst pain, what would you rate your pain today?
I'd say a 4.
A 4, okay. And is that in like your hips, your arms, like where's that pain kind of at?
Just like general achiness around
Achiness,
my body.
okay.
Yeah.
Understandable. And with this pain you're experiencing, are there any sort of activities in your daily life that you have difficulty with?
Yeah, putting on my shoes and socks.
Okay.
Is a bit difficult.
That's understandable. So we will be doing a PNF pattern that will address that area.
Okay.
And then what are just kind of your overall goals for therapy today?
Just to gain strength and decrease my pain.
Okay, good. We can definitely work on that. Just some other things we are going to do next is we're going to do a goniometric measurement of that right hip, and measuring your hip extension just to kind of see where you're at.
Okay.
And then while we're there, we're also going to do an MMT test, which is a manual muscle test, where I'm going to be applying resistance to kind of see what your muscle strength is looking like, okay?
Okay.
And I'll walk you through that as we go. And then we'll get into treatment after that.
Okay.
Okay. So if you just want to stand up for me, and I want you to lay on your stomach with your head on the pillows. Okay? And then while you're here, I'm going to check all your skin. Her skin is intact. Okay, so now we are going to go ahead and measure your range of motion. So I'm going to go ahead and palpate for your greater trochanter. And the motion you're going to be doing is you're going to be raising your leg straight up off the table. Okay, can you show me that motion? Good. And relax. Now I'm going to make sure everything's lined up. Okay, and whenever you're ready, go ahead and go into that motion. Good, and you can relax. Okay, the normal is 20 and you got about 19, so you're basically on the spot, so that is excellent. Next, we're going to do your manual muscle test while you're in this position. So for this, I'm going to be stabilizing your pelvis right here, just to make sure you're not lifting up. I'm going to have you bring your knee up so it's bent. And you're doing basically that same motion where you just bring your leg up straight up to the ceiling. So if you could show me that. Good, and relax. And now what I'm going to have you do is I'm going to have you come halfway, and I'm going to apply resistance. And I want you to count out loud to 3, and I will be applying resistance increasing throughout that. And then I will give you a grade at the end based on how well you perform, okay? So go ahead, come midway, and count out loud.
1, 2, 3.
Good, and relax. That was excellent. You were able to hold that resistance throughout the whole motion, so I will give you a 5 out of 5. If you want to now roll back this way, go ahead and sit back up on the edge of the table. Okay. Since we're here, we're just going to get right into our PNF. Since you're saying you're having trouble putting your shoes on, what we're going to do is we're going to do we're gonna work on your legs, because that is the area you're having some difficulty with, and we are going to be doing D1. So what we're gonna do is we're gonna start out, and we're gonna bring our foot up towards our body.
Okay.
Right, like this. And for this activity, since it is lower extremity, I would have a second person here just in case. But we are gonna do it in a standing position, and I'm gonna have you lean up against the mat table for support.
Okay.
And I will be facilitating. So once I get you up, we're gonna do once or twice, a couple times through, just kind of get a feel of the motion. So we're gonna do it passively,
Okay.
and then we're gonna do 8 reps actively. Then I'll let you have a rest, and then after we do that, we're gonna do 2 sets of 8, and we're gonna do slow reversal to kind of give you resistance throughout the whole thing to make sure we're fluid throughout those motions.
Okay.
Does that make sense?
Yep.
Okay. So I'm gonna have you scooch down, and you can just lean against the table, and we're going to start with your right leg. So I'm gonna take your right shoe off. Okay. So we're gonna start in this position right out here, and then what you're gonna do is you're gonna bend your knee and ankle up, and back down, and up, and back down. Good. And up, and back down. All right. So now that I see that you're helping me out, we're gonna go ahead and get started.
Okay.
So we're gonna do quick stretch down, pull me up, pull me up, pull me up. Good. Quick stretch up and push me out, push me out, push me out. Good. That was 1. 8. I'm gonna put your shoe back on, and we're gonna switch and do the opposite side. Same thing. I'm gonna go through it passively with you, and then we're gonna do the active set, okay?
Okay.
So I'm gonna slide your shoe off. Alright, so we're gonna start in this out position, and then what we'll do is we'll bend our ankle up and our knee up towards the opposite leg. Good. So now that I see that you're helping out with that, we're gonna move into the active set. So I'm gonna do a quick stretch down, bring you up, 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 up. Quick stretch up, push me out, push me out, push me out. And up. And out. And up. And out. That was 3. Up. Out. Up. That was 5. 7, and 1 more. Good. I'm gonna give you your shoe back, and you can just come right here and have a seat and give yourself a good rest. How was that?
Good.
Any
Tiring,
pain?
but good.
Yeah. Okay. Good, good. That's definitely gonna be challenging for you because it's really focusing on that task you're having difficulty with. So you just take a breather and let me know when you feel up to continue.
Okay, I'm good now.
Okay, so I'm gonna have you get up into that same position, and we are gonna start with that right side again.
Okay.
This time we are going to be adding that technique. So the only thing that's really different with this is it's extra work for me. Throughout that motion, I'm going to be applying resistance consistently throughout, just to make sure that we're really challenging those muscles, okay?
Okay.
So we're gonna start with 8 on the right side. Okay, get out to a start position. Quick stretch down, bring me up, 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 up. Quick stretch up, push me out, 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 out. Good. And up. And out. Good. And up. And out. That was 3. Up. And out. Up. And out. 4. Good. Keep pushing all the way down. Good. And 1 more. Beautiful. All right. Now we're we're gonna switch sides, give that side a little bit of a rest. Still doing okay?
Yep.
Okay. Let's take this shoe, get to that starting position. We're gonna do a quick stretch down, come up, 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 up. Good. Quick stretch up and push me out, push me out, push me out. Good. And up. And out. And up. And out. And up. And out. That's 4. And out. 6. 7. And 8. Beautiful. I'll give you your shoe back.
Thank you.
And you can have a seat. How are you feeling?
Good. Just tired.
Yeah. All right, you take a nice long breather, and we are gonna do that once more, 8 on either side.
Okay.
While you're taking a rest, I am gonna talk you through, this is something I'm gonna want you to do at home.
Okay.
For that, I'm gonna have you support yourself at the edge of the mat, or at home, you could do something like your countertop, kitchen table, something like that.
Okay.
I will want you to make sure there is a chair behind you for when you get tired and you need to break. That's totally fine.
Okay.
So you will start and you'll do the same motion, starting out, bringing up, just like that.
Okay.
And what you will do is you will do 2 sets of 8 reps every other day, because the other activity we do will have a at-home program that you'll do on opposite days. Okay. And that is something I would want you to do in the morning, just to make sure that by the end of the day you aren't too tired, and you make sure you get it in first thing in the morning so you can check it off your list. Okay?
Okay.
All right. How are you feeling?
Good.
You ready to do our last set?
Yep.
Okay. So come on up. We're gonna start with that right side again. I'm gonna steal your shoe. Go into that starting position. And we're gonna do a quick stretch down. Come up, come up, come up. And resist me down. Quick stretch up and push me down, push me down. Good. That was 1. 2. 3. 4. 5. 6. 7. And 8. Beautiful. And we're gonna switch and do it on the other side. So you're gonna take your shoe from you. Starting position. Quick stretch down and pull me up, pull me up, pull me up. Good. Quick stretch up. Push me down, push me down. And up. And down. Those 2. And out. 3. And out. 4. And out. 5. 6. 7. And 8. Beautiful. I'll give you your shoe back, and you can go ahead and have a seat. So while I give you your rest, that was excellent. You didn't have any pain with that?
No.
All right, and then I just want to mention too, when you are doing this at home, you should not experience any pain. And if you were to experience pain, I would want you to stop immediately and let me know so we can figure that out for later.
Okay.
So I'm gonna move this set up to the hallway. And then I'm gonna have you walk out here. Okay. So for this obstacle course, we are going to be doing it 5 times through with a rest break, just to make sure you aren't getting too tired. So I'm gonna have you step in alternating holes on this little ladder here. Good. Nice and smooth, and you're challenging that balance. And I'm just here to make sure you're good. And we're gonna weave through the cones. Very good. And as we come up to this chair, you can go ahead and turn and give yourself a rest. How was that? Good. Not too bad? No. All right. You look pretty good doing it. Good. You let me know when you feel ready. I don't want to rush you.
Okay. I'm ready.
You ready? Okay. Go ahead and stand up. And we're just gonna weave back through those cones. Good. And same thing, back through the ladder, alternating sides. Good. Beautiful. And then you can go ahead and sit right here on this bench to give yourself a rest. Good. And while I'm giving you your rest, I am gonna just start talking to you about your home exercise for this. So obviously this is not something I would want you to do at home, as it is truly challenging and it could be a safety hazard at home. What I am gonna have you do is just like I had you do those PNF activities at the countertop. I want you to do some standing marches. So you'll march 10 times on each side for 2 sets. And I would want you to do that on the opposite day you do the other activity. And if you do have pain, you would stop. And you would also have that chair there for safety. Just in case you were to get really tired, you could sit down and give yourself a rest, okay?
Okay.
All right, how are we feeling?
Good. Ready to go.
Okay, let's get at it. All right. Good. Beautiful, and weaving through those cones. Alright, and go ahead and give yourself a rest. How was that? I feel like that was smoother than the other time.
Yeah, that one felt better.
Yeah, you're getting the hang of it.
Yep.
Alright, you let me know when you feel ready.
I think I'm ready.
Okay, let's go. Alright, weave them back through. Very good. Alright, nice and smooth through these ladder holes. Beautiful. Alright, we're gonna take another rest and then we're gonna do it one time through and then we'll give you a seated rest at the end and then when you're ready, we'll just head straight back in and we won't go through it again.
Okay.
Alright, you think you're ready?
Yep.
Alright, let's do this one last time. Okay, through the ladder. And we're gonna weave through the cones. Alright, and while you take a rest, I'm gonna move these cones just so we can get through. And I'm getting myself ahead with cleanup. Alright, how are we feeling?
Good.
You ready to head back in here?
Yep.
Alright, let's head on in. Alright, I'm gonna have you lay on your stomach on the table for me. And since you're in a seat position, I'm gonna grab our camera. Oh goodness. Alright, now just to finish up, I already went over your home exercise program with you and you explained that you were good with that. So just to remind you, I want you to do those every other day. So one day you'll do PNF, one day you'll do your marches, okay?
Okay.
And you should not experience any pain.
Okay.
If you could give me a pain scale, 0 being no pain, 10 being the worst, what would you say you're at about now?
Still 4.
Still a 4, okay. And then I'm looking. Her skin is still intact. Can you just show me that range of motion again? So bringing that hip and your leg straight up to the ceiling. Good. How was that? Any pain?
Good. Nope.
All right, that was excellent. So if you just want to sit up for me, and then you can come right back over to this chair. Good. And do you have any additional questions for me?
Nope.
Nope. All right. Thank you so much for letting me work with you. And I would take your gate belt off and yada yada yada.